are bringing you live from Stemi India 2018 from Lucknow. It's a pleasure to introduce Dr. Brahmajee Nallamothe. He is Professor Internal Medicine and Interventional Cardiologist from University of Michigan, USA. Welcome, sir. So let me begin with a question. Why do you think that why does the time to treat and the STEMI management is very important?
Well, thank you, Hiro, for inviting me here. It's a very important question. And before I get started on this, I just wanted to say what a pleasure it is to be here in Lucknow. I wanted to thank Ajit Malosari and Thomas Alexander and the rest of the STEMI 2018 India Committee for the invitation. It's remarkable how over the last 2 decades, the entire care of STEMI patients has been transformed by this fundamental understanding of why time to treatment actually does matter in these patients. As we know, the pathophysiology behind STEMI is that there's a clot that occludes off a coronary artery. And so each minute that moves onward, the extent of myocardial damage increases. There's 2 ways, obviously, of opening up that coronary artery. One is with thrombolysis, and the other is with primary PCI. Both of these treatments are very effective. Sometimes they are used in combination as well. But the critical thing and driver in terms of how you decide between these treatments is really in terms of accessibility and how quickly they can be delivered. So I think that my talk this morning was trying to reconcile some of the data because it's been a little bit mixed in terms of the effectiveness of both of these therapies when you consider time as an important variable. I think that though the literature around this has really moved towards a consensus, both in the United States, in India, and worldwide. I think there's this understanding that getting patients to the right care as rapidly as possible is essential. And I think that the infrastructure that STEMI India is trying to push forward is super critical for achieving that. One of the biggest, I think, achievements of the last few years, particularly when we think of reperfusion therapy in low to middle income countries, is the example of the Tamil Nadu STEMI project, which Ajit and Thomas and the leadership in STEMI India really rolled out. And it again is really prompted by this idea and fundamental respect for the fact that the longer these delays occur, the more important it is in terms of poor prognosis for patients. So the more we can minimize that time gap and the more that we can get kind of care to the right individual, I think it's just going to improve outcomes. And so what's really exciting is as we take that example from the Tamil Nadu STEMI project and we start to move it into other areas, hopefully like Lucknow, as well as other parts of India.
Right, true. So what do you think, what should be the role of a cath lab and the interventional cardiologist in the conditions of cardiac arrest?
Yeah, so cardiac arrest is a big issue as well. Many STEMIs, the presentation might end up being cardiac arrest as the initial condition. Now, not all cardiac arrests are due to STEMI or even coronary artery disease. They can be due to other things, cardiomyopathies, genetic abnormalities such as channelopathies. But regardless of the etiology, the cath lab has a critical role in cardiac arrest management because these are sick patients and there's very few places that are better for a sick patient to be in the first few hours of their arrival to the hospital than in the cath lab. And again, I talked this morning a little bit about how I see the role of the cath lab and the interventional cardiologist in that overall care. The cath lab is a wonderful place for caring for these patients because you can take care of their acute hemodynamic distress. You can understand what's the reason behind the cardiac arrest and what perhaps prompted the etiology of it. You can evaluate their coronary anatomies and to treat patients with stents if that's indicated. You can deliver things like hypothermia, which is important in patients with cardiac arrest because many of them end up dying from neurologic injury more so than even cardiac injury. And then finally, you can think about advanced therapies and supportive devices which are accessible. Many of these patients with cardiac arrest end up having cardiogenic shock as well. And because of that, and the accessibility of increasing devices such as balloon pumps and other types of percutaneous left ventricular assist devices, you can really stabilize patients and give them that really critical 72 to 96 hour window to see if this patient is going to be able to survive their initial cardiac arrest and become viable. So there's so much to be able to access within that environment that it ends up being a critical area and really a valuable place for patients to kind of get streamlined, that critical care, and then they can go to the intensive care unit or to other settings for more definitive therapies.
That's really great. Thank you so much for sharing your views at the platform of STEM India 2018.
Thank you, Hero.
Thank